Welcome to another video of Health Facts with Dr. Danesh. In this video, we're going to find out the countries and the states that already had the second wave, and we're going to find out what is the best approach after opening the businesses in terms of COVID-19. Also, we're going to find out if lifting social distancing measures had the same effects in different states in the United States of America or in different countries to be able to have the best practice for lifting the social distancing. As of July 2nd, 2020, the total number of coronavirus cases are 10,923,327 people. Current active cases are 4,295,195 people. From these people, 4,237,130 people in mild condition, and serious or critical condition people are 58,065 people, which is 1%. The linear chart of daily new cases is going up, as you can see, and the daily linear chart of death is going down. Total cases per million in Chile is the highest, as you can see, and some of the other countries that has high total cases per million are US, Brazil, for sure Russia, and Spain, Peru, Saudi Arabia, and Italy. However, the highest active cases in US made this country the epicenter of the pandemic. Iran is one of the countries that experience the typical second wave, as you can see right here. And in April the 3rd, Iran had 32,000 active cases. And starting May the 3rd, active cases started to rise, and then up to again 32,000, almost 32,000 in June 20th. In the United States, even though we don't have that downward slopes such as what we've seen in Iran in the last chart, but I believe they have the second wave. As you can see here, it goes a little bit down and then rise up again starting June the 2nd. And just yesterday, July the 1st, United States had the highest daily cases in the history of COVID-19 infection in one day. New York has the highest cases of COVID-19 in the United States, 292,450 patients, 167,460 for California, followed by New Jersey and Florida. In Mexico, even though they didn't have a typical second wave, but there is a big jump from 23,585 people in June 20th to more than 60K in July the 1st, as you can see here. Now in Beijing, China, even though it appeared that they were going to have the second wave, but as you can see in this publication in time.com, it says China appears to have tamed a second wave of coronavirus in just 21 days with no death. It says China appears to have gotten a second wave of COVID-19 under control following an outbreak at a sprawling Beijing produce market last month that led to at least 328 new cases and a partial shutdown of the capital. On Wednesday, Beijing reported just one new confirmed case as well as 2 asymptomatic cases, and this is just yesterday. Following an aggressive campaign of testing on the Zinfati wholesale food market in southwestern Fengtai district, where a new outbreak was detected in June 11th. Even though they haven't reported any death in Beijing, but as you can see here in this chart, which is related to total death in China, there is a big jump in April, almost 1,000, more than 1,000 deaths that haven't been counted. So hopefully this is not the case in Beijing, and we're going to see the truth as it is. Now, as for the second wave in different states, for example, in the United States, this is a very interesting chart from Johns Hopkins website. And as states throughout the US lift stay-at-home orders, reopen businesses, and relax social distancing measures, this graph shows whether cases of COVID-19 are increasing, decreasing, or remaining constant within each state. If you click on a square, which represents a state in the United States of America, you could actually see the updated graph of COVID-19 active cases in each state. The line in each graph shows a 3-day moving average of new cases per day in this state. The greener the background, the bigger the downward trend of new cases in that specific state, and the redder the background, the bigger the upward trend of the new cases in that state. Here we're looking at the Louisiana states, and in April the 3rd, as you can see, they had this peak of the active cases close to 2,100 people, and it goes down. And then afterward, in July again, as you can see, goes up to 1,500 active cases. The first peak of Idaho was in April, and they had close to 180 people, as you can see here, and it went down afterward, but it rise up to reach to the second peak in June 30th to close to 370 people. And we have the same pattern in Florida state, close to 1,900 people in April. It goes down, but slowly, but it sharply rise up close to June 27th, which is the highest number in Florida, reached to 9,585 people. In Johns Hopkins University of Medicine website, there's this very interesting tab called Critical Trend, as you can see here, that shows the connection between the timeline of policy events and the new confirmed cases. The orange signs represent the restrictions and closing every time they happen, and the green dotted lines represent the opening, and then the blue or purple represent the deferring decision to county. So as you can see, from the start on March the 1st, which the cases was 0, it picked up in April to more than 1,500 here, but there are lots of restrictions here implemented in different timing right before the peak, and then right after we have even more restrictions here. And then the opening happened after in mid-May, actually. In June the 1st, another opening phase happened, and right after that, the slope rising up to the peak of more than 1,000 people active cases in July. However, in other states such as New Jersey, that was not the case. First, we have 2 peaks in April and May, but slope going down, and despite the fact that the opening phases administered a lot of time, a lot of these lines, dotted lines, are indicated that there are many opening phases happened right after, but it never picked up. The number of the active cases are still down, and the number of the cases is actually going down as we speak. So it's really interesting that in two different states of one country, the results of reopening the businesses could be the opposite. As you can see in Louisiana, we have seen a second wave after reopening the businesses, and in different phases. But in New Jersey, for example, you see that is the same of phases of reopening happening, and you see less and less active cases. So the results are really comes down to the approaches, the different approaches of different counties, for example, in United States or different countries toward the COVID-19 infection, and how people in each state or each country behave in terms of the COVID-19. For sure, a comprehensive approach of the government or the governor of different states could be critical and life-saving. A comprehensive approach is to find, isolate, and do more testing, including antibody testing, and tracing patients and the families of those patients with COVID-19 to be able to have the best results. Of course, training and educating the healthcare workers and the healthcare system is critical. We could empower communities to protect themselves and others by washing hands, keeping distances, and wearing masks, and also doing tests, as many tests as possible, including the antibody testing, to be able to get the best result in this pandemic. I hope you enjoyed this video, and if you like this video and find it beneficial, please share it in your social media and to your friends and families. And like always, stay happy and healthy. Thanks and have a great day.